We have Michelle Darnell, who is the Vice President of Business Development for Secure Exchange Solutions. She's going to be giving our webinar presentation today. My name is Rebecca. I'm the Director of Marketing Communications for Secure Exchange Solutions. And we're also pleased to have with us Mr. Kevin Hodge, the Director of Health Information Technology Division for the Virgin Islands Department of Health, and Ms. Kathleen Greenaway, the Direct Project Manager for the Health Information Technology Division of the Virgin Islands Department of Health. I'm going to turn the presentation over to Michelle now, and she's going to go ahead and get us started.
Thank you, Rebecca, and good morning, everyone, and thank you for joining us this morning. I wanted to start with just a little bit of background about the project in general and the webinar today and the series of presentations that we'll be co-hosting with the Virgin Islands Department of Health over the next few weeks. So this webinar is actually the first in a series of this education program about using DIRECT for health information exchange. A bit of background about DIRECT in general. DIRECT is a nationally recognized standard. It is a standard way to exchange health information securely and directly with known trusted recipients over the internet. DIRECT is a component of the Nationwide Health Information Network, and it's nationally recognized by Department of Health and Human Services and the Office of National Coordinator as an approved method for securely exchanging health information. In short, it's a peer-to-peer approach to securely exchange health information. It's much less expensive than transferring paper records, and it can help provider offices satisfy meaningful use criteria. As a part of the Territory's Health Information Exchange Initiative, the Virgin Islands Department of Health and the Health Information Technology Division plan to host over the next several weeks a series of webinars on secure data exchange for healthcare providers. So this series is in advance of launching a DIRECT-based health information exchange in the latter part of 2012. So a bit of background about Secure Exchange Solutions. We are a certified health information service provider, and a health information service provider actually helps facilitate direct exchange. So we help enable secure messaging between trusted entities, but essentially this will enable Virgin Islands healthcare providers to exchange patient healthcare information in a secure, simple, and inexpensive manner over the internet. It's important to understand that communications that are facilitated by health information service providers, such as SES, are encrypted, and it's only the sending practice and the receiving practice that actually can view the contents of the data. And so the health information service provider just essentially provides the routing information that's required and the security of the information for secure exchange. The topics we'll cover today are as follows. We're going to spend a few minutes with just learning a bit more about DIRECT. What is DIRECT and how does it work? And then we'll transition to why DIRECT. Why does the healthcare market need DIRECT? Why is it valuable to my practice? How can I use it? How does it help with meaningful use in my practice? Then we're going to transition to a few everyday use cases, and so that to help the audience learn a bit more about how DIRECT is being used in offices today. And hopefully this will help with some ideas in your practice or in your setting about how you could make use of DIRECT. And then lastly, we'll spend a few minutes on getting started and how would I get started with the DIRECT program. And then we'll open up the floor around 9:30, 9:35 for questions. So what is DIRECT exactly? The Office of National Coordinator defines DIRECT as a set of standards, policies, and services that enable simple, secure transport of health information between authorized providers. So direct secure messaging will occur between two trusted entities according to the standards, and it will enable Virgin Islands healthcare providers to exchange patient healthcare information in a secure and simple and inexpensive manner over the Internet. So direct is often referred to as pushed communication. So what that means is your practice can push information securely to another practice. So 4 components around direct. It's simple. It's using a universal addressing scheme. It's secure. Information is encrypted and transported across the Internet, and users can easily verify that messages are complete and haven't been tampered with. And lastly, it's scalable and standards-based. So what's interesting about direct is it's the first universal standard that's been offered for clinical information exchange with anyone in the healthcare community. So why has direct evolved, and why do I need direct for my practice? So there are a few reasons behind this. Namely, providers still need viable options to meet meaningful use exchange requirements. And the other item is that paper cost practices time and money, and it actually often makes for a much more costly workflow. So in terms of meaningful use, the stage 1 criteria, direct enables standards-based health information exchange in support of a number of the stage 1 measures, including communication of summary care records and referrals, discharge summaries, and other clinical documents that are required to support continuity of care and communication of lab results to providers. For meaningful use stage 2, the proposed rules indicate that not only do you need to support data exchange, but there are additional requirements for interoperability with providers. So there is an increased focus in stage 2 for interoperability, and stage 2 actually calls out specifically for the use of direct communications. And a few case examples. One is around the exchange of patient summaries. The second is around the exchange of clinical messages. And transport specifications are specifically called out in the proposed rules for stage 2 for use with direct. In terms of money savings in your practice, direct can help with administrative savings. Paper and scanning cost practices time and money, and direct is a more secure alternative to fax and paper. There are some other reasons why direct is important to a practice as well. You know, what we see in the industry, and a recent Health IT Gov report indicated that the majority of the time, primary care providers do not get discharge information about their patients in a short period of time. It's almost always sent with paper and fax. Technologies like direct can help with speeding up the exchange of information and ensuring that primary care providers and or specialists get information sooner about their patients and in a secure fashion. The other reason that direct is important to the industry is that the cost of exchange of information still is high. And what we found is that the time to develop many of the proprietary exchanges are, it's long, and it costs a lot because of the lack of standardization. So the benefit of direct to the healthcare community is that it is a standard. It is something that the Virgin Islands community can use to exchange information in a cost-effective manner in a fairly rapid period of time. So what is the value to my practice? And why do I need direct in my practice? So this direct is really the first standard that's been offered to the community that allows for secure exchange for any type of information between colleagues. So that means you can use direct not only for exchange of structured information like CCD documents or HL7 documents, but you can also use direct to exchange unstructured information. So all you need to know is a provider's direct email address, and you can start exchanging information securely. And we anticipate that over time, most peer-to-peer information will be exchanged using the direct standard. So this will streamline external communications for your practice, meaning that you don't have to support a lot of different modes of communication with others in your community. So some examples of how direct can help a practice, the area of referrals and referral network and assisting with building referrals, patient history forwarding. So if you need to forward patient histories for collaboration with another provider, or for example to long-term care and nursing facilities, which may or may not have electronic medical records today. You could use direct to support that type of a workflow. Patient care summaries when a patient has been admitted or discharged from a hospital that need to be transmitted to the primary care physician to coordinate care in a more efficient manner. For lab test ordering and results delivery, immunization reporting, and also, of course, to engage patients. So there are a number of benefits to the practice, and we talked about some of these earlier, but facilitating care coordination and improving transitions of care and referrals are two areas that providers can see immediate benefit by using direct and getting on board with direct health information exchange. I think it's always nice to get real live perspective from users, and this is a quote from a current user of direct messaging, Dr. Audrey Corson. She has an internal medicine practice in Bethesda, Maryland. This is a busy 5-physician practice, well known in the Washington, D.C., Maryland metropolitan area, and they provide medical care that's customized to patients' needs. They have a typical blend of e-prescribing and word processing and lab order capability and some light EHR technology in their office. So it's a typical setting that you would see in a physician practice. And they're using SES Direct and the Direct standard to optimize the referral process in their office. So they receive consults and test results from their referral network much faster instead of regular mail and in better quality. So in the case of a fax, for example, if they were receiving an EKG, it doesn't come over, or lab results, it doesn't come over very clearly using the fax machine. And they get it through Direct, and it's much clearer and easier to read and helps with their patient consultations. So to launch the project, the office identified practices that were mailing the highest volume of referral notes and converted these flows into secure email. So the result has been successful, reducing the volume of fax and couriers and the cost of paper, and led to a much more streamlined workflow. So Dr. Corson and her team are successfully using Direct in a practice that's a very busy practice with a lot of activity internally. So I'm going to pause for just a moment before we transition over to what makes Direct different and everyday use cases, and see if we have any questions.
Okay, so I'm taking everybody off of mute. Up until now, we couldn't hear you. We could only hear Michelle. But now we can hear everybody. So if anybody has any questions, this would be a great time to ask. I did have, Michelle, one question that came in electronically. Somebody asked that if they already have an EHR in their practice, why do they also need direct?
Absolutely. It's a great question. And as we move forward and EHR systems continue to improve, some of those EHR systems will, over time, include direct as a part of their offering. But right now, most of them don't, and so direct, and many of them have a secure messaging capability, and the secure messaging capability today tends to be able to communicate with the audience of users that are using that same product. And so the value of direct is if you are using, for example, today, Greenway or NextGen or eClinicalWorks, and you wanted to talk to another office that did not have that same system or that is perhaps even using no EHR system, direct enables you to talk securely today with anyone in your community. So it's a great bridging approach as we all move toward a much more electronically enabled environment. So let's move along. Sorry.
Nobody has any more questions? Okay.
So let's move along and talk just a little bit further about what really makes direct different. Why do I need, if I'm already using email today, why do I need direct? Why can't I just use my normal email? And that's a question that we hear often from provider offices. And the short answer is normal email can be hacked, and that actually can potentially lead to dangerous exposure of private health information. So direct provides your office assurance that health information is encrypted and shipped to a valid and verified recipient, the one that you've picked and the one that you know and trust and have a relationship with today. The other question we get often is, what makes direct different from what the industry knows as more of a query-based HIE approach? And I mentioned earlier that direct is a push technology, so you can push information to providers, to hospitals, to long-term care, to behavioral care coordinators, to care coordinators, into patients at the point that you wish to push information. So you can push, information can be sent back to you at the point in time that makes sense for your workflow. The query-based HIE is a bidirectional pull of information. And so normally you're querying information about a patient from, for example, a portal or a repository, and you're getting, and you're sending back, so you're querying to pull information, you're sending back information in response. So Rebecca just asked a question about, do I need direct if I already have an EHR? And that often leads to the question of, how does direct differ from my EHR message center or my EHR messaging capability? And I answered that, but just to recap is what direct does is allows you to communicate to anyone, regardless of what they have on their desktop, whether it's an EHR or a charting system, or they're just using plain old word processing in their office. And the last point is from other secure email, and there are a number of secure email products that are great, that are in place, especially in larger enterprises. And the benefit of direct is, again, it allows you to embrace entities that may not be part of your secure email network. And that's important when we look at really expanding on health information exchange. So let's talk about some everyday use cases, and there are many. There are too many to talk about on this webinar, but three of the big areas where we see direct being used today are around referrals and responses, emergency care, and patient care. And when we talk about referrals and responses, these are generally workflows of information that that transfer between primary care to specialists and from specialists back to primary care, from information that may be transmitted from primary care to care managers or care coordinators. And in many cases today, social workers may enter into this whole stream of care coordination. In emergency care, one of the key areas we see it being used is in notifying those that typically are taking care of the patient that their patient has been admitted or discharged into the hospital or from the hospital. And this is a wonderful way to give primary care physicians and specialists information about patients that they may not get today until later on. And then lastly, inpatient care and an exchange of lab results around patients, information that may or may not have been, lab results or tests that may or may not have been exchanged previously. So we generally like to walk through a few use cases, and we'll spend the rest of the time on the webinar talking about use cases just to promote some ideas that might be useful in those of you that are listening today, your practice, or that you can envision being useful in one of your colleagues' practice. So in an outpatient setting, as I mentioned, a referral and the notes and information that go along with a referral is a primary area that direct brings benefit to practices. And if we think back to Dr. Corson's quote, this is the area that they focused on in their office. One use case that we've seen is around improving patient care and referrals, specifically in the diabetes area. And this use case involves patients that are presenting at their eye care specialist for routine exams. And in this case, the patient actually had blurred vision, and the problem list that's in the patient chart indicates that the patient had gestational diabetes at an earlier stage in time. So using Direct, the eye care specialist actually refers the patient back to the PCP for a follow-up because of the indication with blurred vision. And the ECP transmits the summary of this visit using Direct to the primary care provider. And the primary care provider, which has a number of different systems in their environment, they order routine lab tests, and they receive actually the lab results via Direct into their inbox, which gets attached to the patient medical record after the office manager reviews it into their EHR product. In some cases, when the patient has a PHR that's Direct enabled, the primary care provider can actually forward the lab results direct to the patient's PHR if it's Direct enabled. So this use case, it presents really the benefits of a team-based delivery that's actually an unaffiliated team. The ECP, the eye care provider, redirects the patient into proper preventative care, and it demonstrates some of what we're looking for in terms of meaningful use by integrating the transfer of the clinical summary to the primary care provider and then eventually to the patient if they request. So this use case is a great example of speeding up information exchange and providing better information exchange between the primary care provider and the specialist. Another use case that I touched on briefly was that we see a number of areas are promoting with the use of Direct is transferring admission and discharge summary information or alerts to the provider community. And I mentioned the benefit earlier on this, and that this basically gets information about your patients faster. And so the scenario is the hospital admits the patient, and may provide the provider with notification of the admittance via direct, or the hospital discharges the patient and provides a summary of this discharge and any information that should be alerted to the primary care provider. And so the benefit of direct is that this information can be pushed to providers in a variety of methods, and the provider has the ability to come in and receive this information either via webmail, or they can receive it into their EHR product in more of an unattended mode. So again, this just shows how information about patients can be transmitted faster, and how direct can be used to improve coordination of care. The last use case I thought I would focus on today, and we will drill down in some of these use cases in a few of the future webinars in more detail, but the use of direct to deliver lab results. And an example of this is using direct to deliver both structured and unstructured lab results, because the direct can be used to deliver images, to deliver text messages, email alerts, and also structured attachments, such as an HL7 document wrapped into a CCD transaction. So this is, of course, in comparison to fax and remote, printer delivery today, but we see this as very much a wave of the future and a way to get results potentially to providers that would not have been able to receive results in the past. We have numerous use cases that we're happy to share and discuss further. So if there are any attendees this morning that would like to look further into use cases or discuss ones that might be specific to your organization, please reach out to us or reach out to Ms. Kathleen Greenaway, and she will put you in contact with us, and we're happy to discuss further, especially ones that might be specific to your organization. And I'm passing through a couple here, the medical records request and the care coordinator summary, which we see also are being used in the direct health information exchange. So how would I get started with direct? If I am a provider in the territory and I'm interested in getting started, what's the process? What are the steps to get started? First, I'm going to register my organization with the Virgin Islands Department of Health, and the team there will work with you to get you registered as a direct health information exchange participant. And this approach really kicks off because as part of registration, you're going to verify some key information with the VI-HIE team, and this really kicks off your pre-registration of your organization with Secure Exchange Solutions. And our process from there is fairly simple. Organizations register and get confirmed in a directory, and they also register their individual physicians if that's what they're interested in doing, in terms of having physician addresses for everyone in their organization. And typically, an organization has an organizational email, for example, primary care at vidirect.net, and they may also have a physician email, Dr. John Smith at vidirect. So there are options about how you set up your organization and how you choose and elect to set up a direct address. Direct messages can be accessed in several different ways. You'll see that there will be a secure webmail portal that you can log into to access your messages and to send messages to colleagues. Direct messages can also be accessed through a client technology that can be attached to your medical record or EHR. And as I mentioned earlier, eventually over time, EHR vendors will integrate direct into their products. So what have we learned this morning in the first basic Direct 101 webinar in this series? So we've learned that Direct is a universal standard for HIE. We learned that Direct can help improve the quality of patient care and help you qualify for meaningful use incentives. And I think most importantly, Direct can help save your practice money in terms of scanning and paper and courier costs, and basically improve the quality of care that you're delivering to the patient. Meaningful use stage 2 requires some components of Direct in terms of the proposed rules for stage 2. We learned that Direct is more secure than email, and it's faster, and it's cost-effective to implement. And we learned about a few use cases, and there are many, but we learned about a few that can help your practice. And Direct will be available to you in the latter part of 2012 through the Virgin Islands Department of Health Health Information Exchange activity. So with this is the end of what we had prepared for today. So I'm going to turn the session back to Rebecca to see if we have any questions from the audience. And we would encourage you to ask questions or to follow up with questions, and then to close. So thank you so much for your interest and for your attention. And Rebecca, back to you.
Okay, I've gone ahead and opened up everybody's microphone so anybody can ask a question verbally. You can also send questions, as some of you have been, electronically on that little questions tab. Michelle, a couple of questions came in while you were speaking. The first one was, do both providers have to be direct participants in order to use direct communications?
The short answer is yes. A provider needs to have a direct email address in order to transmit to another direct provider. What we're seeing in the industry, and in fact, is that there are some bridging technologies that are taking, direct and converting to fax. And in the case of Secure Exchange Solutions, we are implementing capability that makes it easy to refer a provider, so that you could, invite one of your physician colleagues that perhaps is not yet direct enabled to easily join into the direct network. And so, but the short answer is that two parties to communicate direct, they each need to have direct. They don't have to be using the same direct health information service provider or the same direct product, but they need to have a direct email address. And technologies are evolving to make it easy to invite someone to have a direct email address. And I think that's the important piece, is that what we've seen is that it's kind of viral in nature. So if you get a community of perhaps primary care and specialists and perhaps in a hospital setting, and they all want to exchange information, they may not necessarily all have direct email addresses to get started with. Any other questions?
Yeah, we have a couple more. One was, does this product work with all EHR programs?
That's a great question. And So we have to define work with all EHR products. Direct is designed really to encapsulate information in in a message format that can be downloaded and attached to most any EHR product that has a file import and export feature. And so, as an example, the SES has a client technology that can run locally in an environment, and that acts like an unattended, kind of a traffic cop, pulling in information, decrypting it, and tucking it into the typical fax and file import and export flow of an EHR. And so the short answer to that question is that, yes, in terms of any file-based EHR that has a capability to import and export a file. I think it's a fairly safe answer to say that Direct will work in most all of those settings. Now, the ultimate implementation is that it becomes integrated into all the workflows, inside of the EHR system. And over time, we anticipate that we'll see that, but that's not available today. One of the use cases I talked about was specifically a specialty care EHR product that has embedded some direct capabilities into all the workflows within their product. And that's a great setting as well.
Okay, we have a few more.
Okay.
Somebody asked, how do we get a copy of the presentation? That one I think I can answer. I believe we'll be emailing it out, and in addition, we'll be putting both the recording and the handout for this presentation. We're going to be putting it online, correct, Michelle?
Yes, and we will, so you could request that through Kathleen Greenaway or direct to us, and we will make it all available online.
Okay. How long has Direct been utilized by healthcare providers?
That is a great question as well. The Direct project actually kicked off in the early, actually I think it kicked off officially in the 2009 timeframe, but really became active in 2010. And so although it is in the world of standards development, so when I say standards, I'm referring to, like HIPAA, ANSI X12, and HL7, and NCPDP, which is used in the pharmaceutical world. And in terms of the standards world, Direct is still a fairly new standard, but I think it has caught the attention of the industry and that there is a lot of momentum behind Direct, because it seems to have all the right components to make up, rapid deployment at a cost-effective price without a tremendous burden on the provider community.
Okay. Well, now somebody asked, what is the cost for Direct? And before you answer that, Michelle, Ms. Greenaway added that we'd like to mention that during the first year, providers in the U.S. Virgin Islands will be able to participate in the Health Information Exchange System free of cost.
Great. So that's a wonderful opportunity for Virgin Islands provider community. We're seeing in other markets some similar programs, and those are great programs to help providers get on board and start making use of Direct in with little financial or implementation burden. But to answer the question a little bit further, the way so Direct is priced similar to the way you would normally pay for a a wireless subscription service. So there are typically, and you can look across the market, there are typically a few different components you actually need a direct email address, and you get, along with that email address, which is a secure email address, a digital certificate. And a digital certificate is something that is renewed generally annually. And then the third component is how do you actually access the information. So as I mentioned before, there are multiple ways to access that, and those ways have kind of different pricing bands. But I think it's a wonderful opportunity with the offer that Ms. Greenaway provided for the Virgin Island providers to get on board.
Okay, those are all the questions that I have so far. If anybody has any more, let us know before we wrap this up. I don't think so. Michelle, I think we're about done. So I would just like to tell everybody about the upcoming webinars that we will be hosting. We have a direct live webinar on July 31st where we'll get a bit more into how direct works and more details into some of these use cases. We have direct in your practice workflow on August 14th, using direct for behavioral health and immunization reporting on August 28th. And getting started signing up and using direct, we'll get into detail on really how do we sign up, how does everything work, how do you send communications and all that, and that will be on September 11th at 9 a.m. The registration will work just like it did for this one. If you have any questions in the meantime, you are more than welcome to send me an email at rlhasid@securexsolutions.com. My email will also be on this presentation, which we will get out to you. I'm sure that also Ms. Greenaway will be able to address any questions or pass them on to us. Thank you all so much for joining us this morning. We appreciate your time, and we hope that you'll join us in these future webinars as well.
Thank you.